white discharge, in our terminology, medical terminology, we call it leukorrhea, right? Leuko means white, rhea means discharge or water discharge. So it is divided as it's not divided, but we have a healthy discharge and we have an unhealthy discharge, right? One is physiological, which is normal. Like if you are like a teenage girl, we call it a libido. Like you have that, your hormones are changing. You're becoming more women. You are changing from a girl, you're becoming a woman. Okay. So white discharge, if it's good, like you don't have smell, it's just watery, you don't have to worry about it. That's a healthy and that's a normal discharge in girls, right? In teenage girls. In women's, when it's a healthy discharge, during ovulation, you have a discharge, white sticky discharge. That is a sign of ovulation. Like few days before your periods or few days after your periods, you might have white discharge. That's okay. You don't have to worry about it. Second type of discharge is infective discharge, like which is not normal. And being a female, being an individual, we come to know this is not normal, right? So this is you should know that it's not normal. Like it's thick, it's associated with smell, it makes you uncomfortable. That means that is not leukorrhea. That is some infective leukorrhea. You should approach a doctor then. If you're ovulating, then you have a white discharge. Some The most focusing part over here is white discharge abnormal, which is not normal. Okay, so that causes they differ. Like the color of discharge differs, the texture differs, the symptoms differ. We actually classify it as if your white discharge is white, if it's like a cottage cheese, like if it's like something rubbery discharge coming out associated with a smell, if you have itchiness, that means you have an yeast infection. Second thing, if you have a yellowish discharge, like it's just a yellow discharge, you might have pain, right? While pain, or you have frequent urination, or you have incontinence in urine, like the discharge associated with the urine symptoms, is bacterial, right? Third type of discharge, we label it when you have yellowish is a gonorrhea, and if you have a grayish discharge, that means you have a bacterial vaginosis. The color differs, and with itchiness, with the pain or painful intercourse or any urine symptoms, it's not normal. Okay, and you should go to a doctor as soon as possible. Should not delay it. Like most of us, what we do is we try to know, I'll just wash it off, I'll just do apply some ointments, we'll take from the over the counter from the medical stores. Don't do that. The delay you'll do, the situation will become worse. So try to approach a doctor as soon as you feel this is not normal. First, doctor checks you, like what is your discharge, what type of discharge. If you have the white and if you have the itchiness and swollen intimate parts, then she'll definitely label it as a yeast infection, and she will give you antifungals for that. Like we'll treat it properly by the antifungals, mostly like a fluconazole or itraconazole, etc. If it's a bacterial infection, then your doctor might put you on antibiotics course. If it's a trichomonias or if a parasitic or any other infection. So it includes the combination of medications, like you have antibiotics, you have antiparasitics, you have antifungals, and then you importantly, along with the anti-drugs, your doctor will also prescribe you with pro-drugs, right? What are the pro-drugs now? Like pro-drugs means what? Your vagina consists of healthy bacteria, like lactobacillus, acidophilus mostly. So healthy bacteria needs to grow. If the healthy bacteria lags, that means your vaginal pH will go down. Your vaginal pH, as it goes down, the unhealthy bacteria or the yeast infection flourishes. So this is the mechanism, right? Now, along with, like, we are giving the anti-drugs to control the unwanted bacteria and unwanted yeast infection. So this will clean up your vagina. But after cleaning this, you should grow the healthy bacteria. So the treatment is always, I basically do that. I always give the probiotics also, right? So once the antibiotics are done, their work is done, you should start regrowing your vaginal flora, right? So you should always complete a course of at least 15 to 20 days of having a proper healthy probiotics, which should be taken along with the warm water, which is always a good option. Whatever comfortable with food, without food, depends. Like if you're okay with taking the prebiotic like before food, you can go ahead. If you're okay with taking after food, you can go ahead. The only condition applied is you should always have a glass of warm water or lukewarm water along with it. This is how the treatment goes, right? And most importantly, this is just the medications. Now, how personally the treatment goes is you should always lift up your immunity. You should stay away from stress, right? Now, lifting up immunity means what? You should always check your vitamins levels. Like vitamin B12 and D3 plays very important role in your immunity building up. So you should always keep a check. You should always have a supplements of these in your lifestyle, right? So this will help. This will help you from like having the relapse or recurrence of this leukorrhea, right? So this is how it goes, like the few anti, few pros, and few lifestyle changes. Every time we go to pee, we wash the area, right? We call it douching, right? We feel like no, it's uncomfortable. We go and wash it. Don't do that. That's not a good practice, right? What you're doing is every time you're putting water, you're washing off. Again, I'm telling you, you're washing off the healthy flora, right? You're decreasing the acidity of your vagina. So don't do that. You can wash your intimate parts like twice a day, morning and before sleep. You can wash it. Try to use, if you are comfortable, you can use the inti cleaning products which are available in the market. You can use that. If you are not comfortable, don't use it. You can just use lukewarm water. Try not to use soaps. Soaps are actually not good. Second thing is, you should not wear very tight clothes. Like you should not wear jeans if you're not comfortable. Try to wear airy cotton clothes, so that, see, intimate parts are also the organs. They need to breathe, so let them breathe. You should wear healthy, airy, comfortable cotton clothes. Try to like keep a hygiene by like cleaning your clothes properly. Now, as we stay for a city people, especially, I'm telling, we stay in a flat, so there is dampness is there, the clothes are not very dry, and we use the same. Don't do that. Make sure your clothes are dried up properly. They are dry. They are not damp. You change your clothes. If you're living with some roomies or you have the partners, try to keep your clothes separately. Don't use the clothes, right? Try to wash them separately. Second thing, you should lift up your immunity. Again, try to avoid fast food. Have shift yourself to at least like one banana, one apple every day. Like a single fruit might help, right? So these few changes, and try to have a comfortable, stress-free life.